ignoring pain doesn't make it go away. It makes the pain louder later.
Welcome to Get Back to Your Life, the podcast for people who want to feel better in their bodies, but maybe feel stuck because of the pain or unresolved physical issues. If pain or injury has made you feel left out of the conversation around health, fitness, and resolutions, New Year's resolutions, this podcast is for you. If you've ever felt frustrated watching others who are setting fitness goals that you can't safely pursue, or you wonder if this pain is just something that you'll have to live with, you are not alone. We are joined today by two experts who are medical professionals and know exactly what they are talking about, who can get us on the path to better health, to feeling better. You both specialize in helping people move forward when it feels really impossible. So my guests today are Dr. Niteesh Barara. You are the Director of Regenerative Medicine at VSI, and Greg Morris, physical therapist at VSI. Thank you both for being here.
Thank you.
I appreciate this conversation because, everybody sets New Year's resolutions in the beginning of January or, end of December, and then they fail. And it happens more often than not. So here we are to talk about how can you reset those? It's never too late to set a resolution, to start something. But how do we feel better in our bodies? So we're going to make ourselves accountable first before we get to how we can help our listeners. The three of us have a whiteboard here. We've written down the resolutions or the goals that we've tried and maybe failed at or not had done so well at in recent years. So Dr. B, I'm going to start with you. What did you try maybe this year and didn't work out so well?
Yeah. So, one of my goals for last year was to get back to running. And so I wrote down on the whiteboard. And so I really wanted to get back to doing it. About 10 years ago, I would say that I wasn't an avid runner, but I ran, maybe 15 to 20 miles a week. And I really, really enjoyed it. And then I started having kids and that kind of stopped.
Mm-hmm.
And so last year I said, and I'm going to get back to doing it. And my kids, I have three of them, and the other two really weren't excited about running, and, they have to run the mile every year. And so I was like, okay, we'll do it together. And so I started getting back into running. I started running on a treadmill, and then I started, unfortunately, noticing some sacroiliac joint pain. Needed to stop for a little while, and recalibrate and work in physical therapy and get back to it. So this is still a goal.
A work in progress.
It absolutely is, and it's something that's going to happen in 2026. But I took one step at a time to get back to it. I think I jumped in maybe a little too quickly, and I noticed that, and so just kind of getting my foundation right, and I'm going to get back to it this year.
I do hope you consulted your own physical therapist at VSI.
I did. I actually am seeing Larry and John downstairs at VSI PT. They're kind of helping.
Yeah, I know.
Greg.
Right. Yeah.
Greg's so busy. It's one of those things that I always try to get in with Greg, but Greg just can't handle it. So I don't want to take up too much of his time, but I wish I could get it with him.
Yeah, being busy is a good thing, but a bad thing because we are all dealing with this, right? So talk to me about your resolutions.
So my resolution is to decrease my golf handicap. And this is a work in progress. And my kids are older, so I now have time. So I went after it. And I went after it by hitting thousands and thousands of golf balls.
Okay.
To the point where I ended up with a wrist injury, which is a very common injury for golfers. To the point where I couldn't swing a golf club. I couldn't perform my job. I was losing grip strength. I went and saw two different orthopedists. I had an MRI of my hand. I have a torn ligament in my wrist. So you have 8 bones in your wrist, and there's ligaments in there, and I tore one of them, and they're like, you need surgery. And the surgery for this is not a good outcome. They want to fuse the bones of your wrists. I need my hands to do what I do. So I actually sought out regenerative medicine from Dr. Barara's colleague, Dr. Wynn, and had PRP to my wrist, platelet-rich plasma injections. And after about doing my own rehab and strengthening, my strength came back, my speed came back. I don't have the pain. I'm a huge believer in regenerative medicine.
So it's interesting, too, because, speaking with both of you, doctor, physical therapist, that you are dealing with this. So it's kind of, it's almost like it's understandable that everyone is dealing with this. You know the body so well, yet you're still dealing with pain, even though you want to pursue something, which is very debilitating and frustrating. I'm going to hold myself accountable too. One of my goals for this year was to do more sprint interval training. Of course, running too hard. Now I've got a proximal hamstring-ish tendon issue, and it's set me back, and it's really frustrating. So we want to know today, how can we move forward with this pain or fix it in a way? I could dig into your psyches on how we can help our listeners overcome the pain that's slowing them down, including myself too. So
Yeah, absolutely. I mean, I think one of the things, we always want to try to get back into doing something, and we do it really, 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 really fast. And we were able to do it before, where we want to do it again. And so sometimes that turns into maybe a more difficult task than we think about.
Well, so what is the message to those who have a resolution, who want to make it stick, but they can't because they are, in pain? How do you move forward with that? So, Greg, let's start with you. What would you say to someone who had big aspirations, but is maybe feeling a little disappointed in themselves right now because of the pain and the limited movement?
I think I would start with the end in mind. What is it that you want to do?
Mm-hmm.
And look back at their goals and maybe start with mini goals. If your thing is to run, maybe you need to be able to jump on one leg equal to the other, because essentially running is controlled hopping. And if you can't hop on one leg equal to the other, you're going to set yourself up for injury. So I would look back and say, all right, what are your mini goals? How do we get there? And just go from mini goals to macro goals to actually running and sprinting and doing what you want to do.
What about warning signs?
Warning signs would be pain with activity, swelling, radiating pain down your leg, pain down your arm, those types of things. Those are things to pay attention to. Those are things that we probably would lead you to get evaluated by a physical therapist or Dr. Barara.
Mm-hmm. What about you? What warning signs for you? And what's your message to listeners about those warning signs? Because we hear about, pushing through.
Oh, yeah. I think one of the things that we all do is we get back to doing something that we want to do, or we take it to the next level. And we notice that there is some discomfort there, and we just think, okay, just like it's arthritis, or oh yeah, I'm just once I get moving and get lubricated, I'm going to be great, right? And that's to a point. I think that's a very reasonable thought. However, if you're continuing to have pain despite resting or changing the way you're doing things, over 2 weeks to a month, it's better to get looked at and checked out, and to make sure that actually pushing through it is not going to lead you to a bigger injury. And the goal is, if you can address the small injury or the small movement that you're doing abnormally early, you're saving yourself the long downtime that you would get with a larger injury. And so I would tell everybody to really get checked out if they continue to have pain. Pain is a warning sign. Pain is a reason the body's trying to tell you something. So if you're still having pain 2 weeks later, you probably should just get looked at to make sure, hey, listen, you can push through this, or hey, maybe let's step back a little bit and let's address something differently. Let's go see Greg and let's get, let's change the way you're moving, or hey, let's, maybe you have a muscular imbalance. We need to assess and, address that first before we move on to the next goal.
Is it at all accurate at any point to think that, okay, I've had pain for several months now, that it will eventually go away, or do I have to do something about that?
Well, I think it depends. And so I think if you have pain for several months and you expect it to go away by itself without changing something, it's not going to happen, right? And so it may go away when you rest afterwards. But if it's happening for multiple months, there's a reason for it. And we need to get down to that. And that may be that you're just doing the activity wrong, or we need to just adjust slightly what you're doing. Or, hey, listen, we just need a little bit of a strengthening program, or your mobility is wrong. So, getting that checked out early is a way better outcome than just waiting until the injury is so bad that it's surgical, or it's PRP, or it's something a little more aggressive.
And you've likened this, Greg, to a car and having that foundational, working well thing. Talk to me about
Absolutely. So
the analogy
you're a
here.
40-year-old man and you're going to go and start an exercise program. You have 40,000 miles on your body. If you were going to take a cross-country trip across the United States, you would get that car checked out. Get everything looked at by a mechanic. Same thing if you're going to go from something that essentially a couch potato to running a 5K. It's just a good idea to get assessed If you haven't been assessed, then you're opening yourself up for injury. So it's just a good thing. In terms of what we do, I mean, if you look at the definition of sports medicine, if you Google sports medicine, it would say evaluating, diagnosing, treating, rehabilitating athletic populations and athletes. That's what we do. We do that all day long. And you don't have to be an athlete to see us, but if you're trying to be active, it's a great thing to do. So in terms of, I'm going to give props to my Dr. B here. In terms of being a physiatrist is a rehab doctor. And so he can do anything rehabilitation-wise. He can order diagnostic testing, but he's also the director of regenerative medicine. So if you have a tendon issue in your case and you need an injection or a diagnostic ultrasound, it can be done by Dr. B. So the comprehensive approach by both of us can be amazing in terms of sports medicine, getting back to what you want to do.
And I do want to address something here too, because it's something that I've personally thought about, and I'm guessing maybe you have as well. But how do you differentiate between age and pain? So is it just part of the aging process?
We hear it a lot, right? That's one of the things that most patients come in and say, hey, I'm just getting older,
Yeah.
right? Hey, I went and saw my primary care doctor and I just have some age-related arthritis, right? And there, unfortunately, arthritis is something that you gain with age. And so what the primary care doctor is probably saying is not wrong in any way, but that's not necessarily saying that because you have arthritic changes, you can't do X, right? And so we have to understand that, this is normal aging, or this is arthritis, or I'm supposed to feel this way isn't always right.
Mm.
And so I really think when you start hearing that message, that's not really a good message to hear. There are ways around dealing with this. There's ways to feel better, even with arthritic changes. And so, that is a bad message, because when patients come in, usually they said, I haven't done anything for 2 years because my primary care doctor or my friend told me that this is just how I'm supposed to feel. And if that injury was addressed earlier, we may have had better, easier options for them.
Okay. All right. So, Greg, you've seen people along, and both of you have, this whole, the whole broad aspect of this journey. What's the impact of waiting? What happens if you wait too long?
Well, I think what happens if you wait too long, then you start defining yourself by the pain. I have back pain, I can't do that. I have knee pain, I can't do that. And then it becomes a whole psych issue that I can't do things I want to do. And
You're limiting yourself.
Yeah, and what happens is it kind of regulates up your nervous system so that it can't do these things. And then become afraid. One of the worst things you can do in life is be afraid to do something. So if you're afraid, if you're not engaging in what you love to do, come see us.
Okay. All right.
Yeah, I mean, I think that's a really good point. What you said, this fear avoidance. You avoid doing the activities. You avoid taking that next step because I'm just going to hurt again, or this is just how it's going to be. So I'm just not going to do it anymore. And what that does is it actually pulls you away from the activities you like to do, your family, your friends. And so a lot of the activities that you want to do that make you happy, you stop doing. And you don't need to do that. I mean, there are lots of ways to go back to potentially running like I want to do, or playing pickleball or picking up your kids,
Sure.
right? So, I mean, you can do it, and but we avoid anything that's going to hurt us. And so that fear avoidance is really important. And that's something that physical therapists, they do a great job. Get moving. This is one of the things they do. They show you how to get moving and how to do it pain-free. And so that's a very, very important part of physical therapy. It's really avoiding, it's teaching them not to avoid activities that may have made them hurt before.
Excellent point. Excellent point. Before we move on to some of those solutions and what people can do to help themselves, I want to set the record straight. So no pain, no gain is really not a great piece of advice.
I wouldn't agree with that advice. I mean, you're going to have some soreness, but soreness should dissipate in 24, 48, 72 hours. But if you're having pain, most likely you're doing something wrong. Maybe it's a technique. Maybe you're loading a joint that isn't used to being loaded. Maybe you don't have the strength yet. I would say pain is definitely a warning shot.
Mm-hmm. You would agree with that?
Yeah, absolutely. I mean, I think pain, there's a reason why we have pain. Pain is your body telling you that you're doing something wrong, or there is something wrong. And so it needs to be addressed and changed. There's a very big difference between pain and I feel sore. And so feeling sore is maybe not a bad thing. And I think it gets confused quite a bit. And so people will think that soreness is I'll just push through it, and then they get a little bit of pain, and then they just keep pushing through it. And so that small meniscal tear in the knee may turn into a large meniscal tear that needs more than an intervention instead of a good PT program.
Right.
And so we really need to address these things early. Don't push through pain.
And you're talking about two different extremes here, the PT versus more intervention, surgery. There's a gap here. So what is that? What is that gap? And talk to me about how you work with a patient who is in the middle there.
Yeah, I mean, there is a treatment gap, right? We have always traditionally gone from patient comes in, they have an injury or an issue, they do physical therapy, maybe that doesn't help. They're stuck in this window of time when they're said, well, I'm just going to keep doing what I'm doing until I get to something where it's bad enough to do surgery for, right? That's kind of you hear from your surgeon a lot is, oh, you're just not there yet. Give it another couple of years and then we'll do surgery, right? And so there's this treatment gap of what do you do for the next 2 years? Or how do you avoid getting to that point where you need surgery? And so the gap has always existed. The difficult part, go back 5, 10, 15 years ago, is that we didn't have a lot of options to fill that gap. And that gap is now starting to fill in with a lot of non-operative treatments that we could use to potentially avoid or delay that surgical intervention. And that could be the PRP that Greg talked about that he got to his wrist. That could be, working on a different type of strengthening program with blood flow restriction. That could be some of the other interventional techniques like stem cells or prolotherapy, microfragmented fat. Like so many options have filled that gap, and that those options really depend on the person's pathology or the person's issues.
Yeah, and like you said, it depends on the person. But are you seeing in your practice success where people are overcoming their pain because of these interventions?
Absolutely. I think one of the misconceptions of the gap, because it's so new over the last 10 to 15 years, and I call that new, there's a lack of education and there's a lack of understanding that these options actually exist. I saw an OBGYN just last week who's in medicine, right? In medicine, and has been dealing with a spine related issue for almost 7 years, right? Never got anything done for it because they did physical therapy. They're not ready for surgery. It affects their job at this point, so they can't take 3 months or 2 months to and not go back to work and operate. So they're stuck in that treatment gap. And this is a surgeon. This is an OBGYN that does surgery on a regular basis. And the only reason why he decided that he was going to come and see me is because his son, who's 18 years old, came and saw me. We did a stem cell procedure on him. He got dramatically better.
Wow.
And now he's like, what about me? And so, the treatment gap is something that's been proven over years, and we have good level 1 evidence that shows that this actually works. But there's a lack of education, both in for us in medicine and for the layperson who's not in medicine.
Right. How did the PRP work for you, Greg?
Fantastic. Yeah, and just to piggyback on what Dr. B is saying is, I think traditional medicine was like medicine 2.0. You diagnose and you would treat. Now, if you look at it more medicine 3.0, if you quote Dr. Peter Attia, it's kind of getting into the point of prevention. There's markers out there, there's research out there that shows how you can live well into your life and have good fitness and wellness and everything else. So I think that we're kind of taking the approach of let's get on top of this, let's address it, assess it, see what we can do to help things improve.
And every patient is different, like we said before. So it's PT, PRP, platelet-rich plasma, regenerative medicine, or surgery. So it spans a wide spectrum. Do you know in the first few meetings that this is what a patient will need to do, or is it following them along for a while?
Yeah, I think it depends on the situation,
yeah.
Right? And I think there are times where you can have to start with surgery, or there's times when you start with the regenerative medicine procedure, or the majority of the time, we want to start conservative, right? The majority of patients can get better with a good PT regimen. A good PT doesn't involve just saying, hey, go do this exercise, go do that exercise. In the end, it involves a good physical therapy. Like Greg, he goes in, first thing he does is there's an evaluation. And that evaluation isn't, hey, it hurts here, okay, you need to go do this exercise. That evaluation is really assessing the biomechanics of it all and looking at if there is an ankle issue, looking at the knee, looking at the foot. There is a good evaluation that goes into. So all PT is not equal, number one. Number two, you can start anywhere in this this is a spectrum. If your injury is so bad, we may jump to a regenerative medicine procedure and then do the rehab for it. So it really depends on the patient, the situation, the correct diagnosis. Once you look at all that, you find out where they are and sometimes we have to start early and just, at the very beginning and then just watch them through the whole process.
Mm-hmm. How long does PT take? It depends.
Depends on what the injury is, but it takes a good 6 to 8 weeks to develop any strength. And just to piggyback on what he said about standard of care, there's a completely different standard of care in PT as well as regenerative medicine. In terms of our model, we're one-on-one with the patient for an hour. There's not too many practices that allow that to happen. He spends all the time with you that you need. If we have a problem in PT, I text him weekly, like, hey, doc, can you look at this? Can you do this? Almost bugging him on a weekly basis.
It's a lot of text. Well, it's good. It's good though.
But just to see what we can do to help the patient.
Well, it's interesting to me having all of these services together in one practice because you can consult with Greg. Greg's seen a patient who can consult with you, and you guys are working together very collaboratively.
Absolutely. I think that is one thing that I think is missed in medicine in general. Being, physicians and physical therapists and, other medical subspecialties all working together for one goal. One goal is to get that patient better.
Right.
And when you can work and actually talk to each other versus sending them your last progress note so they can try to figure it out, there is a completely different level of different standard of care at that point.
It's a puzzle.
Absolutely.
It's a puzzle. So talk me through my tendon issue. So if I were to come to you, do I first go to PT? Do I first get an MRI? Like what for a typical patient, what's the process?
So if you were to come in and we would assess you, and let's say you were Achilles tendon, just for an example. And let's say I felt a nodule there or felt something that was very painful to you. And I was concerned about a tear. What I'd probably do before loading it is I'd probably text Dr. Barara and say, hey, can you put an ultrasound on this and see if it's torn? And if he looks at it and he says, no, it's not torn, she just got a nodule there, then we know we have the free rein to do whatever to get that tendon stronger. And then we'd load it conservatively. We have an aquatic treadmill. We'd unweight you in there and try to do things to get you better. And if you weren't progressing and weren't getting better, then I would contact Dr. B.
Mm-hmm.
Yeah, the way he's approaching it is exactly how I would do it, right? We work together in this situation. I can't do everything, he can't do everything, but together we can do everything. And so, a patient comes in and we look at it and we say, okay, I put an ultrasound on there. I want to make sure that we don't see a tear. If we see a tear, it's an MRI. It's potentially a more aggressive next step. If there is no tear or a nodule, we get him into a good PT regimen. We start there first. And you may not need that MRI initially. We may be able to get you better with looking at under diagnostic ultrasound and then doing a good PT regimen and then getting back to the activities you'd like to do. So it really depends.
Yeah, you talked about the OBGYN and the success you've had there. Tell me a couple of other examples of patients who you've been able to get back on the right track.
Yeah. I have lots of different types of patients, right? People come to me with many different goals, and just like Greg mentioned earlier, we want to assess what they want to do. What are they looking to get back to doing? Are they a high level athlete that
triathlon?
Or do they want to run they want to go do a triathlon?
Yeah.
Right. Or is this a patient that I have young kids and I can't lift them anymore. And, my rotator cuff is so bad that, or my shoulder is so bad that I've had shots in it from orthopedics and I'm not ready for something surgical and I need to do this. Right. So we have to look at the goals that we have for the patient. And so,
as you said, back into it.
Yeah. And so, it really depends. I mean, I saw a patient that wanted to go back to triathlons and had lower back pain and really couldn't swim, right? Because every time he went into extension, he had pain and he had been doing PT for 5 years and couldn't get better. And then we did a regenerative medicine procedure in his spine and we got him back to that goal.
Wow.
Right. And so versus, a young female that, had a baby 3 months ago and had continued pain in the shoulder through pregnancy and after pregnancy. And then we did a procedure on her, and she's able to lift.
What was the procedure?
So we did a hydrodilation with PRP to the rotator cuff. So she was getting frozen shoulder, and she had a rotator cuff tear. And so we were able to stabilize the rotator cuff tear and start improving that, and then regain her range of motion with hydrodilation of the joint. So she's now able to actually lift her child above, above 90 degrees, which is huge when you have a newborn and you're depending on other people to really help you. And so, it brings happiness to yourself, and it improves your mental health.
Very briefly describe, because we talked about PRP in our regenerative medicine. What is PRP?
Yeah.
Very briefly.
Well, regenerative medicine is the process of using your own body to heal itself. And there are lots of ways that we implement regenerative medicine in our practice, especially in orthopedics. And one of the ways to do it is PRP, which is platelet-rich plasma. And this is where we take the patient's own blood, and we use their own blood by precisely placing it back into an area of injury. And so what that does is it damages the area a little bit initially, just to restart the healing process and actually cause that healing process to be in a super therapeutic environment to actually heal.
Okay.
And so it is a really easy, simple, quick procedure to get somebody to recover. I mean, not just feel better, but to actually heal. It's very different than our normal process in medicine, where we treat the symptoms. This is not treating the symptoms. This is going down to the root cause and trying to get them to actually get better in a different way, so they don't keep coming back to us.
So thank you. And let's provide some clear next steps for listeners too. If they are experiencing pain, the chronic pain for, two or more months, all of the warning signs that you both mentioned, what is the next step for them? What are maybe 3 steps that they can take to get back to their life?
I would say in the state of Virginia, we have direct access, which means that you can see a physical therapist without a physician prescription. And as of June 2023, we don't even need a physician prescription. So if they can start with a PT and come in, get assessed, see what's going on, see if we can help. If we can't help and they're not improving, that's when we involve Dr. Barara.
Yeah, I mean, I think the direct access program is fantastic. Many people don't want to come in and go see a doctor immediately. They want to start feeling better, and having somebody like Greg who's an expert in what he does can get somebody assessed, diagnosed, and looked at. And he knows the red flags. He knows the times when we may need to move forward with a diagnostic imaging study or something more aggressive, and he will get that person to me. And at that point, we'll assess the situation, make the correct diagnosis. And once you have the correct diagnosis, you can look at all the potential treatment options that are available.
Okay. All right. What would you say, Greg, to somebody who has been pain-free for a while, but inactive? How do you move forward?
I would look at their goals. I would see what their goals are. I mean, there's essentially 2 types of goals. There's an avoidance goal. Like, I don't want to do that because of that. I want to run because I don't look good. Or there's an approachable goal. Like, those are more positive type goals. What is it that I want to do? How can I do this? Set maybe mini goals to achieve that macro goal. Those are the things I would start with. And just to go from the couch to running a 5K, there's a lot of steps in there. There's many programs out there, but unless they've been assessed or they have previous injuries or fearful, that's when I would seek out a physical therapy consult.
Okay.
Yeah.
Anything to add there?
Yeah, I would tell everybody out there that first thing you do if you've been extremely inactive is just start moving.
Yeah.
Just start moving. See how you feel when you're moving. You don't necessarily have to go back to the activity that you want to do, but just start moving. See how you feel. And if you're starting to do that activity and you're not feeling well, get checked out. Make sure that this is the right time to restart that activity, and you shouldn't start maybe something a little easier first.
So it's it's for those who are experiencing pain. By the way, it's never too late to start that resolution. It's
not.
January, February, March, September. So that's the point here, and that everybody does at some point in their life feels pain, and there are solutions. So the reality check is you don't have to choose between deal with it and wait for surgery, right?
Yeah.
There's a gap there that is fillable.
It is fillable, and you shouldn't wait to surgery, right? Because surgery is potentially avoidable.
Yeah. There are real solutions in between there, and a perfect way to start 2026. I really appreciate your insight. Thank you so much. I will be coming to see you for my tendon.
Please do.
And I'm so glad that your resolutions are being fulfilled now that you have, as medical professionals, addressed your own issues too. So Dr. Barara, Greg, thank you so much, both of you. Really appreciate it. And here's to a happy and healthy 2026.
Thank you.
Thank you.